Ireifej here, board certified surgeon and chief of specialty at TrueCare for Pets in Studio City, Los Angeles, California. Today we're very lucky. We've got my two surgery technicians here, Lindsay and Jay. What's up, guys?
Hi.
So they've got plenty of experience in the field, and will offer some unique insights to this topic for today. And so we thought we would talk about what makes you think your veterinarian is a good vet. And a lot of people go these days based on word of mouth. They'll go online and look at reviews. They'll try and figure out to the best of their ability where to go. Where can you find a veterinarian who seems like they are compassionate and competent? And so I thought we would touch base on this from our perspective, because as a referral hospital, we tend to see clients here sent here from other hospitals. And a lot of them already have veterinarians, either family veterinarians they've been using for many, many years, or a veterinarian they just started with. And we'll hear the good, the bad, the ugly from our clients. And over the years, and I think Lindsay and Jay will agree, we've noticed sort of trends in what people like and don't like to experience with their veterinary visits. And I'm referring specifically to family veterinarians, general practitioners, the doctors that take care of your animals when they're puppies and kittens all the way to when they're really old. They're doing the vaccines and the preventative stuff, taking care of your pets for all of your general needs, which is vastly different than what we do here on a daily basis, which is emergency and specialty care. So I think probably one of the biggest things that I see with clients who are pleased with how their veterinarian conducts themselves during a veterinary visit is bedside manners. And I would even argue that bedside manners itself is probably just a subset of a bigger umbrella, which is clear communication. I think clear communication is probably the number one reason why pet owners love their veterinarian. They may not realize that. They're going to say things like, the office is very nice, the front staff is very welcoming, my veterinarian's super smart, saved my dog's life, they seem like they really care about my pet. And I think all of it, to some degree, falls under the title of communication, clear and consistent communication, which, if you contrast to human medicine, it seems that they don't get a lot of, especially from their primary physician. You go in and you see your doctor, or you go into the hospital for some unexpected emergency. You deal far more with the nurse than you do with the doctor. You never see the doctor. When they do come around, they don't seem like the friendliest, or they seem like they're in a hurry, or they're just not paying attention. Or I hear all these different complaints from my own clients who talk about their own visits to physicians. So I think communication is probably one of the biggest reasons why, or how, a veterinarian is judged by a pet owner. What do you guys think about that from your experience as veterinary technicians? Do you think communication is a big part of why people like their vet and will go back to them? Or do you think there's some larger factor that plays a role in why people like their veterinarian?
Yeah, no, I think communication's a big thing. I think having that FaceTime with the veterinarian is important. We had a client today where we were talking about this same situation where, versus human medicine, how much FaceTime do you have with your doctor? And with veterinarians, we expect a lot of that versus, just coming and taking the pet and leaving. And I think that gives people a real big sense of fear or anxiety when they don't know what's happening. They want things to happen with them in the room with the veterinarian. And I think that provides a level of comfort for them.
I've also been in a practice to bring my cat in where the vet didn't even touch my pet. And that was upsetting to me. Mm-hmm. Mm-hmm. There was no listening of the lungs or the heart, no feeling around any kind of body part whatsoever, no ear check, eyes, nothing.
And what did he tell you?
Just based on visual observation, what I should do. And it was really,
doctors are
did that too, but it was really upsetting to me, and I never went back.
Yeah, and a lot of that bedside manners, a lot of that stuff that you would expect to see, which most of us in the profession would consider basic, ends up either making the experience amazing or horrific, depending on which direction your veterinarian ends up taking. And I think a lot of what the veterinarian's actions are, both physically and also verbally, are really mandatory to trying to display to you as a pet owner who usually are not medically trained, what their competence level and what their compassion level is. And I think that the communication aspect of all of this, between what they're saying and how they're presenting themselves and how they're acting, what they're doing to your pet, what they're doing with your pet, the tone of voice they have, the confidence to which they speak, and what have you, is all vital to trying to create this environment that can convince you, the pet owner, that, hey, I'm a veterinarian, I know what I'm doing, I have your best interest in mind, I have your pet's interest in mind, I'm going to recommend what I think is best for your pet. And a lot of that can be lost if communication is poor. I think if things like simply, just like Jay just said, if you don't touch the pet, I mean, it sounds basic, right? But it happens. You should touch the animal, you do your examination. Even something as simple as just petting them while you're talking to the client, it means a lot to clients, showing that you're compassionate and you care. And it's not to say that a veterinarian does not fulfill these criteria, that they're a bad vet. They obviously have a lot going on. They're seeing multiple appointments, what have you. But when you're in that room with them, you want to be the attention, or rather, not necessarily you, but your pet. You want your pet to be the center of the world in that moment during that appointment. Whether the appointment is 5 minutes long or an hour and a half long, you want to feel like your pet is the center of the world. Your veterinarian is communicating to you their compassion and their competence through both verbal and physical actions.
I think it's also like a relationship, though. It's like swiping on Bumble, and you don't know what you're going to get till you get there, and you don't mesh well with everyone you meet. And I think that's an okay thing to admit, like, that you aren't, on a certain level with a client, or the owner isn't on a certain level with you. You guys aren't meshing well. And sometimes as an owner, you have to find another veterinarian that you feel comfortable with and that you feel as though your ideals are aligned with, or that you're compatible, so that you're getting the best care. Because sometimes you just meet a person and you're like, we're not.
I don't care much for you.
Yeah, exactly.
I think follow-up care is important too. Like getting a call the next day to see how the pet's doing, if you have questions, because sometimes people are afraid to ask questions
or they just
afterwards, or they forget.
Yeah. I get home from the doctor all the time and I didn't ask any of the things I wanted to ask.
But then it's hard to reach your doctor.
Yeah, you can't do it.
And again, it's all under clear communication. You call the next day, your veterinarian calls you the next day to see how Fluffy is doing. That's clear communication. It shows compassion. If you have a veterinarian that you're just not meshing well with because they have a very specific personality type that you're just not driving well with, well, then you should speak up and you should communicate to your veterinarian and say, no offense to you, I'm not sure we're on the same page here. Do you have a colleague that I can see instead? You shouldn't be offended by that as a veterinarian. You should actually be thankful that your client is voicing their opinion, because no matter how that appointment goes, at the end of the day, they're probably not going to come back to you if you're their only option and you guys really aren't jiving well. So I'll go also to a second point then. So we've established that a good veterinarian portrays himself by having clear communication, both verbal and nonverbal. That seems to make sense, and that can be applied to anywhere else in the world, not just veterinary profession. We can then go ahead and talk about veterinarians actually being able to successfully transmit their hard work and their intelligence to you as a pet owner. I think a lot of times we as veterinarians do ourselves a disservice by not portraying to the owner how competent we actually are. I can do a surgery, go over the surgical implications beforehand, perform the procedure itself, show them the post-operative x-rays, go through medications, I meet my support staff, go over everything we've done, and I'm still not convinced that the client actually knows the technical skills that it took and experience that it took to make this procedure a success. Now, we go through the procedure quite fluidly because we've been doing this for many, many years, and a lot of these procedures are routine to us. But I think as veterinarians, we don't give ourselves enough credit for the work that we do. We also don't really adequately transmit that information to the client. I think a lot of clients leave away thinking, well, okay, I kind of know what they're going to do. Doesn't sound like a big deal. They pay this enormous bill, and then they're like, okay, well, I paid this huge bill. They did some stuff. I think it's going to be okay, and then you hope the pet does well. And they really don't have an appreciation for how much work went into taking care of that pet, whether it's surgery or intensive care in ICU or what have you. I don't know if we gloat enough. And and not in a way that sounds pompous or egotistical. I don't know if we actually toot our own horns enough to clients to sort of make them understand that a lot of work went into this. And ignoring finances, of course, because that plays a role too. Typically, the more work you're putting in, the more expensive it's going to be, right? Or the more experienced person you're dealing with or specialized, the more expensive it'll be. That's probably to be expected. But I don't know if we actually successfully portray to owners like, listen, we're fantastic at what we do. You're at the right place. You're in great hands, and these are all the details behind what we do and why we're so great, without sounding obnoxious, obviously.
I don't know.
You think we're doing an okay job with that?
No, I just think they don't want to hear it most of the time. At that point, they're just concerned about money and, how their pet's going to do. They don't really think about everything that we did that went into saving Fluffy or making Fluffy walk again or whatever it may have been. I think people they think we're like a McDonald's.
Drive right through.
Yeah, I'll take a number 2, and then my dog will walk again, and then great, thanks.
There's always some sort of magical healing remedy that they think we have.
Magical Chinese herbal fever.
Yes.
Yeah. So it may be just a bottom line.
Yeah.
So it may be, and this is both for pet owners and for veterinarians listening to this, it may be that the initial interaction between you and the pet owner is clear communication, both verbal and nonverbal. Convince them that you're competent. Convince them that you're compassionate, which the majority of you are. You have to just convince them. It is a service industry. We are providing a service to these folks. And then the second portion of it is bottom line. Basically, did I get what I expected to get out of this for the amount of money that I paid? Was it worth it?
But then when complications arise, that changes the whole game and how people perceive us and act when they come for their rechecks or other complications associated with whatever they had done previously. And then it just becomes something else entirely.
Yeah, complications are an issue. And I think that also falls under the umbrella of clear communication. The risk factors and complications associated with anything you're doing, whether it's medical or surgical, ideally would be laid out in front of the pet owners so they understand all the possibilities, because outcomes can be really good and also really bad. And usually really bad outcomes translate to not only more issues for your pet, but also more money out of your pocket. And so I would file that underneath the category of clear communication. Because at the same time, whenever you purchase a product, whether it is veterinary care or something more tangible or what have you from other services, whatever it may be, you're paying with the expectation that you're going to get, for the most part, what you paid for. Understanding, of course, there's always a possibility that this car you bought is a lemon, or the electric done in your house went wrong, something went wrong, and it can happen because you're human beings, you're prone to error, not everything's perfect. But if the communication is not laid out in plain sight to the pet owner at the initial visit, then you're going to have a very hard time reversing now their lack of confidence in you and your work. And you have a client who's now unhappy.
Well, it's a hard line because you want to discuss complications, but you don't want to play too much into it because you don't want them to be like, well, why is he or she...
Why should there be complications?
Yeah, and why is she putting so much emphasis on this? Why is this such a big deal that this could happen when they're telling me it's a 1% chance, but they're trying to drill it home, versus you kind of skim over it, hey, this could happen, and then when it does happen, they don't remember you telling them that, or, they don't recall having had that conversation with you at all, and then we're in a whole other situation. Sometimes you just can't get them to listen, period.
Yeah. I think that's true. And so again, it comes down to really just bedside manners. You want to be able to instill confidence in your clients, let them know that what you're recommending should be performed, and at the same time, there's pros and cons to what you're about to do. And it should not be a dismal experience, nor should you be overly optimistic. If somebody is saying that I 100% guarantee you the outcome will be this, well, there's something wrong with that, because we know nothing in this world is 100%. At the same time, if more than half of your appointment is spent talking about complications and risks and it's all doom and gloom, well, then certainly there would be something wrong there. Either this veterinarian has had previous experiences that were negative, or they are not confident in their work and are secretly hoping that maybe you won't perform the procedure they're recommending by scaring you away with all these different complications. I've seen all permutations of this over the years, from training young doctors to even experienced doctors who just never really got the confidence they needed to portray to the owner, here are all the risks, but you should do this. The benefits outweigh the risks. So let's circle back to, again, what makes you think a veterinarian is a good veterinarian? And it seems to be that, to progress towards a summary here with this conversation, communication, both verbal and nonverbal, very important, whether it be bedside manners or frequent follow-up or being thorough with your consultation, showing that you actually care about the pet, that you're doing a full, thorough workup on the pet, and convincing the owner that what you're paying for is well worth it, and that the benefits of the procedure, the recommendations outweigh the risks.
Yeah.
1906, yeah.
So it seems that for pet owners who are listening to this, here's the advice we can offer you. You want to have a relationship with your veterinarian that is positive. You want to have one where you seem to jive with their personality or their technique of practicing medicine and communicating to you both verbally and non-verbally that they're not only competent but also compassionate. You want somebody who's going to go through pros and cons of what they're recommending in a clear and concise manner. You also want them to be able to convince you as a client, as a customer, that the amount of money you're spending on whatever it is they're recommending is well worth it. It's well worth the expense. Understanding, of course, that expense does come with possible risks and complications with it, as nothing is 100% guaranteed. And it seems that if you are visiting your veterinarian and then the stars align with regard to these factors, well, then you can be reasonably sure that this is the veterinarian for you. And hopefully you can spend the next 10, 15 plus years of all the many animals, dogs and cats and what have you that you acquire over time. You go see them for all of your pet's needs. And obviously, ruling out, of course, any days that your veterinarian seems more stressed or anxious than usual because they're having a bad day, which we all have, or we're very busy, which we all have. For the majority of the time that you spend with your veterinarian, you always feel like they are compassionate, they're alert, they're in the moment with you and making you and your pet the center of the world during that appointment. And that way you feel like when you walk out of that hospital that you got everything you paid for plus some, and you have now the confidence in knowing that you have not only a competent doctor, but also a compassionate doctor taking care of your pet. I want to thank Lindsay and Jay for joining us today. Thank you, everybody, for following us on our podcast. I hope this helped. This is Dr. Shadi Ireifej, Chief of Surgery, board-certified surgeon, and part owner of TrueCare for Pets in Studio City, Los Angeles, California. You can follow me on Instagram, Facebook, and YouTube. Please send me any questions or inquiries you may have. Anything that you want to know that's veterinary related or even off topic, we'll be happy to address. I want to thank you so much, guys, and take care.
Bye.